forum we've given today is for helping you sort out the FAQs to just lighten that anxiety and panic which is now everywhere. So I hope I've set the expectation right for everyone. And over to you, Anupam, for the next part of this session. All the best.
Thank you, Anjali. Thank you very much. First of all, once again, ladies and gentlemen, good morning, BNI, and thank you very much for joining today's session. The whole idea was, as the BNI Delhi South mantra is for the day, that BNI Delhi South khata hai kasam, members ka saath chhodenge na hum. Our BNI Delhi South family has demonstrated this over and over and over and over and over again. And we thought, Colonel Dhall had invited us, Anjali and I, yesterday to one of his talks, and we thought that it was a brilliant talk and it couldn't have been more time appropriate. So here we are. Before I hand over to Colonel Dhall, Colonel Dr. Dhall, so it is in order that we introduce him. So it's there on your slide. He's a graduate of FMC Pune, post-graduation from Mumbai, and then DM Cardiology under Dr. K.K. Sethi from GB Pant Hospital, Delhi. He served in the armed forces for 25 long years and has a Sena medal to his credit. His interests are complex interventions. In fact, there is also an intervention under his name called as the Dhall maneuver, aortic and carotid interventions, preventive cardiology. He's been there, done that. He's been an associate professor and then a professor in the Army Research and Referral Hospital in Delhi, Cant, director of cardiovascular sciences, Venkateshwar Hospital, Sarvodaya Hospital, and then at DHLI also he was director cardiology. He's now he was a senior consultant cardiology, Max Heart and Vascular Institute. He's currently also working with as professor and head cardiology in Janak Puri Super Speciality Hospital, Delhi. All this does not do justice to what I know of Dhall sir. I prefer calling him Dhall sir. He did a number of interventions for my father. He's been my cardiologist, our family's cardiologist for I don't know how long. More than that, ladies and gentlemen, he's one of those doctors with a heart of gold. I have not only seen him say this, but he walks the talk. He says, all my patients are my family. So without further ado, ladies and gentlemen, please, in the traditional BNI member, let's welcome Dr. Dhall with a clap in the chat box. Over to you, Dhall sir.
Thank you, Anupam. Thank you, Anjali. Thank you, BNI, for this opportunity to communicate with you all. I am a strong believer that education is the only way we can deal with most problems. Giver's gain may not be a very pleasant thing in the times of Corona, because you should not give somebody the virus. You actually don't gain much because it spreads all around. It goes to your families, it goes to your friends, it goes to your contacts. But helpers gain would be the giver that would be more important. And I know how socially committed Anjali and Anupam are, and I guess the rest of you are as well. So with your collective efforts, I will think that we shall overcome. So one day, when it is, we don't know. Right now, we are battling a surge. We are battling a surge while our television sets are blaring results of a crazy election exercise across many states in the country, whether it's Assam, Bengal, Tamil Nadu, Kerala, Puducherry. So the television sets are kind of going crazy. And there are people like this. I've been really humbled by this pandemic and this surge. This morning, somebody told me, आप अगर बेड नहीं इंतजाम कर सकते, ऑक्सीजन नहीं इंतजाम कर सकते, सारी उम्र आप भाई होने का क्या फायदा? We felt really humble. We felt really small. But that should not take away the fact that regardless of the challenges, we still have to rise to the occasion. And I can do only my bit. I can educate you all on simple steps which you take. Because these are the days not only of social media, which spread things more viral than the coronavirus itself. You know, what is the thing which travels fastest in the world? It's a rumor. But more than that, it's not just news, it's also fake news. So to be able to distinguish the wheat from the chaff, I can only offer you science as is, so that we should not be in situations like this. We should not be in situations like this, and we should not have to send messages like this to our kith and kin. Allow me to take you back 102 years. Year 1918. Now, none of us were born. We collect this from our history books. A misnomer. Spain had nothing to do with causing the Spanish flu. We may or may not believe that this time around the Chinese had something or did not have something to do with causing what Donald Trump used to refer to as the Chinese flu. So, but the Spanish flu, the World War I had just ended. Troops were just returning from the battlefields in Europe. Ships had taken those troops. They were lodged in ports like Mumbai, and the flu struck. Believe me, mankind has not really grown, because in 102 years, we may have more tools, more toys to play with. We can do RT-PCR, we can do CBNAT, we can do rapid antigen test, we can do CT scans. We may be able to offer remdesivir, tocilizumab. But the predominant thing is, in 1918, the message was stay at home, mask, lockdown. And despite pleading to our powers that be and the people that be, we ought to have had a lockdown 3 weeks ago, at least to battle this surge. But for whatever reasons, the powers that be have not listened. I am not a politician and I don't want to go into that. Yes, the lockdown happened the first time because there was no treatment then. There is no treatment now. What they did then was isolate these people, give them oxygen tanks, and go through this. What happened was that there was a small surge and there was a lockdown, and we all applauded ourselves at that time. We were not there, and at least not in this Janam. They applauded themselves, and then it was announced the lockdown is over. People came. It is said that in downtown San Francisco, in the Central Square, people danced in joy, music played, wine flowed, and they hugged each other. And what happened? There was a deadly second surge. This second surge was predicted. Every virus mutates, especially viruses which cause flu. These are very fragile structures, but they have very high infective potential. And they constantly keep mutating. So probably it mutated into becoming the coronavirus. Now, the coronavirus is not something new. A lot of animals have coronavirus. We have different coronavirus. The COVID-19 is caused by the novel coronavirus, which, because it was discovered in 2009, the disease is called coronavirus disease 19. And the second surge which happened with the Spanish flu was devastating. It left millions, villages after villages were annihilated by this. We can refer to this as a biologic pralay. But it should not only despair. We can despair and we can lament, but I don't think that's the motto of like-minded people who are on this group today, because people who are here want to do something different. And we have real inspirational stories from this 100-year-old who actually recovered, and this 105-year-old with his 95-year-old wife who came out of intensive care. Fantastic. A tribute to the healthcare workers of this country, a tribute to the spirit, the indomitable spirit, the willingness to fight and live another day for these people, not to lament their age. Remember, it's an unprecedented crisis. This crisis is more than any war that we have fought, even the nuclear holocaust. It is more than the war on terror as was unleashed, and so on and so forth. And we do not know if the worst is here yet, or the worst is yet to come. Mankind is not prepared. It was not prepared then. It is not prepared now. And all this was highlighted by the work of this great man. I salute him because Dr. Li Wenliang was an ophthalmologist. I refer to him as was because he himself succumbed to the coronavirus after pointing out that he's seeing patients who come to him with maybe conjunctivitis or little coryzal symptoms, and 1 week later they're dead. And he said something is happening. He had no access to virology. He had no access to anything else. But he pointed this out, and he pointed this out from this city called Wuhan in China. And really, a lot of effort was made by the Chinese government, despite all the criticism. I've been in touch with a lot of my Chinese colleagues, and they tell us how China galvanized to contain this infection. They withdrew resources from all parts of the country. Overnight, made 1,000-bedded, not makeshift, but good hospitals. China can do it. Provided them with infrastructure, provided deep genetic analysis, provided a lot of details and a lot of things. They had nothing to go by. We still have their experience to go by. We did not learn from their experience. They wrote books, they published articles. We did not learn from them. So despite the xenophobia, which has kind of gripped the world, I would still pay some credit. Of course, the Chinese government hounded Li Wenliang, and he arrested him, and he ultimately succumbed to this virus. The Time magazine called him the person of the year 2020. I think he's the person of this century. The collective weight of all the coronavirus, which has brought the human race on its knees, ladies and gentlemen, is less than 2 grams. Yes, less than 2 grams. Reminds me of a Nana Patekar dialogue in one of the movies. But yes, we have all fallen and succumbed to this virus. I want to take you through some biology, although Anjali warned me that don't give overhead transmission because ye samajh nahi aata, and she actually tried to find out, because we are from the same school background, and she tried to find out who my English school teacher was. And I promised not to use any tharuresque in Angrezi during this discourse. So I just want to point out that why things are confusing is because the virus firstly does not read a textbook before it attacks you. So it's not going to have a time patterned illness. The vulnerable patients are going to be those who are obese, those who are hypertensive, diabetics, those who have lung disease, those who are smokers, those who are immunocompromised like cancer survivors or are on drugs which are going to compromise your immunity. And once the virus attacks, it attacks itself to one of the receptors. I'm not going to go into details. And then there is initially just a simple cold-like, a common cold-like, or chota sa viral ho gaya, that kind of thing for about a week. Then it kind of involves quickly, in some cases, it can be more rapidly than others. It can involve the lungs, and it is a rapidly spreading pneumonia. Now, traditionally, we used to use a chest X-ray to diagnose a pneumonia, right? But this goes into the interstitium of the lung. Now, the lungs itself are like a bag of cotton. And if it is spreading in between the cotton, it'll be difficult for an X-ray to find this out. However, a CT scan is a very good tool to find this out. Now, this pneumonia, because involving the interstitium, can affect the oxygen transport. And because it does that, the patient's oxygenation may plummet. The third stage is when the body mounts a response and releases deadly chemicals called cytokines to attack this viral infection. But unfortunately, they also attack the patient itself. So this is a stage of host response or hyperinflammation. Now, I will go through this same slide many times during this presentation, just to highlight that to do these tests like PCR, if done in this phase, you will not get a positivity. The positivity comes around the day 5, because that's when the virus starts getting replicates and comes out into your nasal cavity or oral cavity. Again, if you do a CT scan here, there is no pneumonia. So you will not get an abnormal CT scan in the first week. You probably get it in the second week. And also, if you have to have an anti-inflammatory attack, if I am sitting there with a Sten gun and trying to sort out the inflammation, if I start doing it here, it's inappropriate. I have to do it here. The problem is that these phases kind of merge together, and that is where the role of a physician is to decide what is to be done, what is not to be done. So what is this? I don't want to take through a lot of biology because Anjali warned me against it, except to show that there is a strand of RNA and there are some spikes on top, which are called spike proteins. That is the structure of this virus. And the estimated incubation period is approximately 3 to 6 days, but can be from 1 to 20 days. It usually starts by an upper respiratory catarrh. A catarrh is like a common cold, and it may have a cough, a high temperature, and a very typical symptom has been a loss of taste, especially a loss of smell. Now, the medical word for loss of smell is anosmia, but I shall refer to it as loss of smell. That's easy. You can get fatigue, lethargy, shortness of breath, headache, sore throat, aching muscles, diarrhea, vomiting. All of it can happen. But you need to remember that if you test very early, your test may come negative, and that may not really be important. Now, like I said, this virus mutates, and the clinical profile in the first surge that we saw almost 8-10 months ago and now is a little different. You continue to have headache, sore throat, feeling sick, high temperature, loss of taste, smell, muscle pain, diarrhea, breathlessness. But this time around, we are also noticing people who have ulcers in their mouth, people who have dry mouth, and say, I need to drink a lot of water. People who have got a lot of diarrhea or vomiting or even constipation, people who have conjunctivitis or pink eyes. Some people have a patchy tongue, which is called a COVID tongue. Some people have swollen red toes, less in India, but more overseas, and some people have pain in the ear or feeling heavy in the ear or decreased hearing or giddiness at this time. And these are all new symptoms, which we are seeing more by the current surge. There are some good things and not so good things. 50% of people who contract this infection are going to be asymptomatic or have unnoticeable symptoms. So you may do, and that may, you may not even notice it. Or you may think you have a headache. You can ascribe very many other reasons. You can always think, as I always joke, and Anupam has heard this before, head to ek hi hota hai. But 30% more, about 80% will have mild disease. About 15% will have more severe disease, which may include a pneumonia, and especially those who are vulnerable. 5% will have critical illness, and 1 to 5% will have mortality. Now, herein, please understand that this is transmitted by droplets, which come out when we speak. And if there was no laptop in front of me, but you all were sitting where the laptop is, by this rapidity and the force of my speaking, I would be transmitting droplets to you. If you were sitting without a mask and I was sitting without a mask, and the distance was, even if the distance was 3 to 6 feet, and if you use common air conditioning, then it becomes even more, because these droplets can act on contaminated surfaces and we can get this infection. It is a very highly infectious disease. So you need close contact, maybe up 6 feet, but if it is unprotected, you will be benefited. If it is, you will not be benefited. If it is protected, you may be benefited. And the contact is usually a contact of as much as 15 minutes is enough. The infectivity starts prior to your displaying any symptoms. Even when it is incubating in your body, you could already start to infect others. And till about 9th day after you get symptomatic, this kind of progress continues. So this is largely airborne, and we need to especially be careful about people who cough or sneeze, because that is an explosive transmission and it goes further still. And you need to be able to make sure that you understand this graph, which tells us that even day -2, you can still be infectious. And from day -2 to about day 10, you are going to be infectious to anybody who has an unprotected contact with you for more than 15 minutes. Remember, we will talk about the fact that the incubation is maybe 2 to 20 days. The virus is culturable maximum around day 5 of infection. This transmission, like I said, happens much more if it is indoor, especially in poorly vented, air-conditioned, common spaces like elevators, offices, even when you go and take your family out for dinner, which has a common air conditioning, and everybody is scared of coming to COVID hospitals, but people were not scared in the interim period about visiting their favorite restaurants. Not that I have anything against the restaurant industry. They are really bleeding at this time. But what I'm trying to point out is that if you are in an enclosed space without active ventilation for more than 15 minutes, you're very liable to contract this illness. However, the same rules don't apply if you're out in the open or you are in well-ventilated scenario. Once again, these droplets which emanate when you are talking, coughing, or in contact, they are usually 5 micron. And just to point out, your hair is 60 micron in diameter. So these are so small that they can actually be airborne. And when you share air conditioning and you share the air quality of a particular place, you can actually be transmitting. And the chance of transmission is highest if you're unprotected and closer than 6 feet for more than 15 minutes. It is very low if you're both masked and have a distance of 6 feet. If you're masked appropriately and have a distance of 6 feet, and there are virtually none if you're staying at home. So that's why the lockdown. Now we spoke about masks. There was a lot of political effort around the mask. We had a leader who was trying to proclaim cloth masks are good. Yes, cloth masks are better than no masks. And at that stage, we had no masks in the country. But 3-ply masks are better than cloth masks. And an N95 mask without one of those rebreathing valves is better still than a surgical mask. So we need to understand that when we are wearing a mask, we need to take some precautions. We need the mask to be reasonably tight, and it should be secured. It should not be too tight so that you get a headache. It should not be worn on your forehead or on your mouth, under your nose. You should not touch your face after you've worn it. And it should definitely not be worn around the arm or around your neck. And when removing it, you need to be clear that you need to clean your hands with a 70% alcohol-based sanitizer solution. If you have an exhalational valve on your face mask, just cover it with a polythene or one of those tapes, and you are going to be good. You should try and perform hand hygiene before putting it on or after discarding. Never use a soiled or a wet or a dirty mask. Never reapply a mask after removal. I know that the country said, "Dhoop mein rakh do 3 din, it'll become okay." Well, if there are deficiencies in the mask, we know there was surge pricing on these masks. At that time, it was probably relevant to do it. But today, when masks have become inexpensive, we should try and ensure that we use it appropriately. And mask utilization has been likened very much to an undergarment. I know that there are some of my colleagues who said that your face is not a private part, that you need to cover it. Completely inappropriate statement, because if the face, if your nose and mouth are the points of entry of this deadly, devastating virus, which can not only infect and kill you, but it can kill a lot of your loved ones or people around you unsuspectingly, you must treat your mask like an underwear. For obvious reasons, do not touch or adjust it, do not borrow or lend it. Make sure it fits tight but comfortable. Make sure it's clean. Wear the right side out. If there are holes in it, throw it away. If it's stained, throw it away. If it's damp, change it. Not like this. So you can see somebody's wearing his mask just to help him sleep. And most people are wearing a mask to avoid the 2,000 rupees police fine. There's been some talk in the second surge about wearing a double mask. If you are wearing a mask and you are staying at home, you are even wearing a single mask is probably good enough. But for those people like me who come out and are working with patients, I not only wear two masks, I also wear a shield like this to protect, to minimize the transmission. So there are many things to do when you're wearing a layer, and normally you can combine a cloth mask. So for ladies who want to appear more dapper, they can use color-coded or color-matched cloth masks in addition to N95 masks. So we must also not forget hand hygiene. We wash our hands before we eat food. It is just 30 seconds. You don't need anything fancy. You don't need a special solution. Any soap, any 70% alcohol is good enough. Now, once we get infected, this virus kind of goes into our system and it starts multiplying. Once it starts multiplying, it starts releasing and shedding some of its viruses into your nose, into your mouth, and these are the ones who are going to infect others. And the body mounts an antibody reaction to this virus, but the antibody reaction is a little delayed because it does not happen immediately unless and until you are immunized or you have suffered from this disease earlier, in which case the memory cells generate those antibodies much faster. So let us just look at this graph. It'll help us explain a few things. You will start infecting others from before you realize it, even before your symptoms. But if you were to detect the virus, you need to do a test. And like I said, the tests are rapid antigen, which has a sensitivity of about 50%, a PCR or a polymerase chain reaction, which has a sensitivity of about 70% or 67%, and a CBNAT, which has recently become available. A PCR takes about a day or two to get a report. A CBNAT, you can get a report within 45 minutes. It's a cartridge-based test. It's a nucleic acid amplification test, but Anjali will tell me too much jargon here. So thereafter, once we get an infection, we understand that this test is going to be positive for a few days. And positivity is going to continue for about 10 to 14 days, by which time we start getting an antibody which can be counted now, and that can actually tell us now which is the best place to sample. Actually, the best place would be to get a bronchoalveolar lavage from your lungs, but we don't do that. So everybody is scared of getting that little thing up their nose or in their mouth. How uncomfortable is it? How uncomfortable is it? Especially for those of us who are needle phobic, it becomes very important to realize that yes, it is a little one fleeting second of discomfort, and at least you get your result. If the sample is collected small or poor or poorly transported, or even otherwise, 1/3 of people are going to have a negative report. And if your symptoms are classic, you should repeat this test in 48 hours, or maybe do a lung CT scan, which if you are thinking that the clinical profile is there and yet you are RT-PCR negative, then we very often do a quick CT to help us decide. So like I said, once the virus comes, there is some response of this antigen there is some adaptive immunity. We're not clear completely about the immunobiology of this virus. It does activate the B cells to produce antibodies. It also activates the T cells. So people who have strong and more robust cell-mediated immunity, and it was thought that people who have received BCG, and the first time around, everybody said Indians are protected. Bah, nothing will happen because we have received BCG. But yes, the role has come down in our understanding, but there will be some role for natural killer cells. But if you have memory cells from vaccination or from a previous infection, then your antibody production is much faster. Now, this amplified slide is actually the basis of what I want to talk to you. Although the virus does not respect these boundaries, and like I said, they merge and blend with each other, and you need a qualified and a sensitive, intelligent physician to be able to determine where your point is. But even as public, you must know that in the first week, it's largely going to be coryzal symptoms. You may have a GI upset, you may lose your smell, you may have any of the other symptoms that I spoke about. But by and large, this is going to be behaved like a common cold. Thereafter, you will start getting this hacking cough, and maybe you will start feeling a little breathless or you have some chest pain. This is normally in the pulmonary phase. In this viral phase, we do not like to suppress your immunity. Rather, we want to give you drugs which will boost your immunity. Antivirals would be appropriate treatment during this phase. Firstly, we don't have very strong, potent antivirals which can be given orally. We ivermectin, which is actually a deworming agent. There is some data for its use. There is some data for use of a drug called favipiravir. But normally we can give it only after the patient has either tested positive or has distinct CT signs or has a definite history of contact with typical symptoms, or in some cases, we look when there is a rapid antigen test positive or some of these we start favipiravir. But in the pulmonary phase and in the hyperinflammation phase, we want to suppress the inflammation. And that is why steroids have become a kind of mainstay. The other very important part in the pulmonary phase has to be to maintain oxygenation, and thereby this mad rush which you are seeing, which is almost catastrophic, the way people are running around in desperation to get oxygen cylinders, oxygen concentrators, and so on and so forth. Specialized drugs, which have again hit the black market, unfortunately, in our country, is drugs like remdesivir or tocilizumab should be reserved for those who are admitted to hospital, including convalescent plasma. So this is an outline which I want you to remember. To recap, it's a very highly infectious disease. Quickly, you will infect 3 people, so we call this the R naught. The mortality is limited. That's about 1 to 6%. 80% will have mild to moderate disease, but including 50% who may not even notice they had any symptoms. 10 to 15% will have severe disease requiring a hospital bed. So unfortunately, large number of hospital beds are occupied by these people in mild moderate category because they are to janta nahi main kaun hu category of people. 5% need intensive care unit and are critically ill. There is a large asymptomatic infectious pool because 50% are going to have no infections and these people are going to infect others. There is a humongous amount of vulnerable population, which I pointed out. There are going to be different stages, a stage of incubation, which is 2 to 20 days, a stage of virus replication, which can start from 2 days before acquiring symptoms to about 9 days afterwards. At this stage, you can have coryzal symptoms, you can have an early pulmonary phase. Now, this is a multi-system disease, and the same receptor which is there in the nose, in the lungs, is also there on your endothelium. So it can cause a clotting disorder, a hypercoagulability or thrombophilia, and can have some clotting issues which are created. It also leads to an immune dysregulation, which because of the cytokines which are being released. So in this stage, we need to modify the response by using steroids. We may need to give blood thinners. And in this stage, we definitely need to ventilate a patient to maintain oxygen. So this is, remember, this disease does not spare anybody. I've lost at least 3 colleagues that I knew personally and very well yesterday, including the person who was possibly my best intern ever, a brilliant orthopedic surgeon. We lost him to this disease yesterday. We lost a very senior gastroenterologist because oxygen ran out. It is, I do not know whether I can call this word as a systems failure, or if somebody were to be nasty, call it genocide. But this disease does not spare anybody. We have world leaders, politicians, bureaucrats, teachers, students, sportsmen, all professionals, but the maximum mortality and morbidity has been with healthcare workers, not just with doctors. Yes, doctors are under great pressure, but nurses, paramedical staff, technicians, your tests are being delayed because we don't have trained technicians to sample or to test your PCR. We don't have radiographers to be able to do your CT scans. So please, 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 I would beg you people to be gentle with healthcare workers, because right now they are not all thieves. There are bad people in every community. There are profiteers, black marketeers in every community. But let me tell you one thing. This is one time that despite having spent 40 years as a physician of some stature, I cannot get a single patient admitted in any hospital, because the powers have been usurped by the people who own the hospitals, and they have disbursed it only to their administrative staff. Why is it? Is it to dole out favors later? I do not know. Is it for monetary benefit? I do not know. I don't have access. Like I said, it is a multi-system disease. This will involve the endothelium. It will cause hyperinflammation. It will cause some clotting. It will affect 78% affect the heart. There can be slow heart rate, high heart rate. Some people who have heart failure can worsen during this time. Some of the symptoms can be chest pain. I was woken by a colleague at 0345 last night with chest pain. So it's good for him that, poor guy had to travel all around the town, but his ECG remained normal. So I've actually told him to get a COVID test done. And the worst part, I'm repeating ad nauseum, is that 20 to 85% of all infections don't come from somebody who thinks he's infected. They come from people who think they're clean. So quick recap: spread by close person-to-person contact, 2 to 20 days, and diagnosed only with the lab test. Headache, cough, sore throat, fever, chill, shortness of breath, new taste, loss of taste or smell, diarrhea, constipation, muscle pain, body pain, COVID tongue, COVID toes, dry mouth. These are all symptoms. Best way to protect yourself: simple. Hand washing. So isolation, stay at home, wear a mask. And if you feel sick, isolate yourself, inform your healthcare provider, clean and disinfect surfaces. So this is so much about what we know about this disease. Now, the vaccination program this country started on 16th of January this year. I got my first shot on the 17th of January. People use Facebook to put their posters and proclaim that hey, I got my first shot. Good of you. And maybe it helps spread the good word. But there were a lot of misgivings. Many of my own colleagues had vaccine hesitancy. So I'm going to give you a little bit of technical information, much to Anjali's disappointment, on how we came across these vaccines. Normally, it would take 5 to 10 years for a vaccine to be produced, but mankind and scientific world and our basic science research has worked over time, and in very little time has produced very many choices of vaccines. But we are spoiled for choice. But whenever that happens, we keep getting these phone calls, मैं Covaxin लगाऊं कि Covishield लगाऊं. So we are spoiled for choice, but let us understand these vaccines. We can have killed virus vaccine. We can have RNA vaccines. These are popular in the United States. We can have an adenovirus vector vaccine, which is using a chimpanzee adenovirus vector. This is the Oxford vaccine, which they had to give to AstraZeneca, and Serum Institute got it and is sold in our country, or given in our country as by the very debonair Adar Poonawala, who now is residing in London. They are being sold as Covishield. So this is these are the vaccines which are available. These vaccines can use different platforms. It can use live attenuated, inactivated virus like some RNA, some DNA. You don't really need to go through that. When the WHO launched and encouraged the vaccine program, and we realized that the only way that we have of defeating this virus, unless it mutates itself out of infection, is to have at least 50% efficacy, not more than 2 doses, usable in adults, and protection for at least 6 months. Singapore government used a brilliant word, circuit breaker. They thought that they would do all this and create barriers of lockdown so that the circuit would break. Even vaccine, why only 6 months? Why didn't we look for longer protection? Because we said, if we get 6 months, we'll get our act together and get the rest of the things going. And by good COVID appropriate behavior, we'll be able to contain this. Now we are spoiled for choices. We have at least 2 mRNA vaccines, which are going to come to India shortly. They're available in the United States. My brother, my brother's wife, my son, they have received either the Pfizer or biotech or the Moderna mRNA vaccines. Well, we use chimpanzee adenovirus vector vaccine, which is called the Covishield. And now we have an inactivated vaccine, which has been indigenously produced by the ICMR with Bharat Biotech. It is called Covaxin. It actually, theoretically, has an advantage over Covishield. And look how people are. When Covaxin was released by the government, there was no phase 3 trial data. So people used to ring us up and said, "Hame kahin se Covishield lagwa do." But now that there are some reports of a clotting disorder with Covishield, and some countries have banned its use in less than 60 years of age, people ring us up and say, "Hame kahin se Covaxin laga do," which means that we still don't have much consideration for our fellow citizens. Although I knew that Covaxin had some inherent advantages, my hospital got Covishield and I went and took the jab. I knew that the best result of Covishield come with the second dose at 12 weeks. The government said it cannot really take on the healthcare workers unless we finish the second jab soon. So I took my second jab at 4 weeks by the government. But ideally, Covishield second shot may be between 8 and 12 weeks, whereas Covaxin is 4 weeks. Now there are these inactivated virus vectors, like I said, is the Covaxin. There are some protein subunit vaccines, and there are some mRNA vaccines which are being tested. There is some data for they're being tested in pregnancy and lactation as well. And there is now a trial which is going to do those children about 12 years, because otherwise we did not have a lot of data. The viral vector vaccines are like Covishield, and we have good real-time world data. What does this vaccine do? What has been proved? Does it stop you from getting infected? No. Because like I said, once you have the vaccine, the memory cells will kick in. But it's not a barrier to infection. You will get infected, but you're likely to have a milder course, unlikely to get severely sick, unlikely to get critically ill. Unlikely. And since you will get infected, it is very appropriate for you to continue to have COVID appropriate behavior by distancing, isolation, and masking. So this thing has to be remembered. And remember that one shot gives you an efficacy of about 60%. And once you take 2 shots, then it's about 70 to 80%. So there are some safety issues. I can tell you that there are few and far between. India has not stopped.
Please.
Sorry?
Go ahead, sir.
So,
somebody unmuted. Go ahead, sir.
Okay. All right. So the thrombosis incident, which because of which Canada, Belgium, and France have limited its use less than 60 years of age, occur 1 in 100,000 to 1 in 250,000. Are yaar, agar itna bad luck kharab hoga to kuch bhi ho jayega. You will be reasonably protected even after the first dose, but for good protection, please take the second dose. Please, 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 because you're actually going to not reach the ICU if you have taken the second dose. Only then will you be completely protected. What about, there's been a lot of talk that these vaccines are useless against variants. We don't know. Enough work, this requires billions of dollars of research. We don't know, but we have epidemiologic data to say that the Covaxin at least is good enough for the 617 variant. And some of the variants at least give you a generalized protection against any form of vaccine. Vaccines work. They don't stop you from getting infected. That infection doesn't stop you from infecting others. You are as much a risk to your family, even if you are vaccinated. But it stops you, who is vaccinated, from getting severe or critical disease. So this is being referred to as the Peltzman effect. For example, this is not from medicine or from science. The Peltzman effect is, suppose I wear a helmet and drive my Hayabusa. If I am driving it rashly and I get into an accident, my propensity to get a head injury may be less. But it does not mean that I indulge in more risky behavior. And only if a significant portion or complete immunization of the whole population will happen, which is a humongous logistic exercise, we cannot stop COVID appropriate behavior. So there is a lot of vaccine hesitancy. Each one of you, I would request to counsel, advise, suggest, and push people who have vaccine hesitancy to give it up. The government has many challenges in reaching the vaccine to people. There are some suggestions. I think on the 28th, the Covet app, the Arogya Setu app, and the Umang app have been opened for people above the ages of 18. And we now can vaccinate more. But both vaccine efficacy and coverage and COVID appropriate behavior are important. Soon enough, you may not be able to travel if you don't have a vaccination certificate. So these vaccines are safe, although they've been produced in short time. They are safe as of data now, and they should be reasonably safe, but they protect you. They don't protect you from getting or transmitting infection. They protect you only from getting seriously sick. If you can follow this much from this talk, I think the jargon was well worth taking. So register, you still need to have all the documentation, etc. We will spend a few very depressing moments, and there should be a disclaimer here. If you see these photographs, they are not photographs taken by me. They have been collected from the internet and Twitter accounts, or maybe from newspapers. They are very depressing. But that should motivate us to work harder to make sure that we, our families and our loved ones and our friends and our circle and everybody around us and humanity is safe rather than sorry. We are going to discuss this surge which has happened now. I told you this even with the Spanish flu pandemic. We had a lot of COVID inappropriate behavior once the lockdowns came out. Everybody questioned the wisdom of lockdowns. Yes, the lockdown was with a purpose to galvanize the country to prepare itself for the second surge, but we failed to do that. We failed to make sure that we had adequate manpower. Some people took work from home as a way of terrorizing their subordinates and making them work 20 hours instead of 8. The other people took it as an opportunity, because now the maidservants were not there, of learning how to do jhadu pocha at home and maybe picking up a hobby. And the third kind of people actually watched a lot of Netflix and put on some more weight during this time. But we did not strengthen our infrastructure here. The second wave, with all viruses, mutations are constantly happening. And once the virus became more mutant and more severe disease, it had to happen. I am not an astrologer, but it had to happen. And we've had a surge, more than 25 to 28,000 registered cases, about 10% people dying from this every day in the last 10 days or 12 days. This is ghastly. But what are we battling? Are we only battling a mutant virus? Well, maybe yes. We are also battling a lot of COVID idiots. And I will take you through the life of a COVID idiot. And we are battling what we know. India spends less than 1% of its GDP on healthcare. Everybody thinks that there is a lot of trust deficit when it comes to approaching a physician. Some bad eggs make the whole egg pile bad, or make it stink. One rotten fish makes the whole pond stink. But everybody is not bad. I am spending time with you here when somebody could think that I would be making money somewhere else. We are trying to help people understand their disease A lot of us are working non-stop in trying to, I have just now tried to get somebody to deliver 50 or 100 concentrators flying from Turkey, because we know that our healthcare infrastructure sucks. It is really bad. And our supply lines are completely overwhelmed and there's no end in sight. So much so that the WHO chief calls it beyond heartbreaking. Let's not take away his empathy or sympathy here. Let's not react to it and say we can look after ourselves. All hospitals which thought that they had stopped their coronavirus wards have had to repopulate them. We have jumped to the caseload. We don't have oxygen. We don't have cremation grounds. We know that oxygen is in short supply. We lost a senior colleague yesterday who was on a ventilator because in one of the premier corporate hospitals, oxygen ran out. The worst way for anybody to jump onto the headlines of a national newspaper. This is my comment when I saw the newspaper this morning to my wife. Oxygen, we all knew that oxygen, India produces enough oxygen, but very little oxygen was for medical use, largely for industrial use. And cities like the NCR, which are non-industrial cities, don't have industrial oxygen. So we've had to haul it in tankers. This will take time till we get our act together. We never planned. We asked for fire certification from hospitals. Nobody ever asked their hospitals about their supply chain management, about where they get their oxygen. We have these NABH and other audit systems when we go to hospitals, JCI. We've never asked them, how do you manage your vendors? Some of you may be vendors to hospitals. We are not serious in Delhi about lockdown because we all think we have a sense of entitlement. I know so-and-so, so-and-so, so-and-so. I know Anjali, I know Anupam, they'll get me out of anything. So this is why Maharashtra, the Mumbai caseload has dropped to about 3,000, whereas our caseload is still exploding. It doesn't puzzle me. We doctors can keep blaming everybody for COVID inappropriate behavior, but this is multifactorial, not just one cause. What spreads faster than wildfire is a rumor. What spreads faster than a rumor is fake news. But even this virus is spreading like wildfire. We are having, these are very sad scenes of mass cremations. What about these mutations? We know that even in the US, when the surge happened a few months ago, we kept thinking that it is Donald Trump's misdemeanor or his couldn't care less approach. But actually, they had a mutation even then. We have some fast-moving variants. Typically, the Kent mutation or the UK mutation was centered around Punjab and Chandigarh for obvious reasons. You know, flights take off from Punjab and come into the UK for all the connect that we know. And now we've had a Maharashtra variant, which is a double mutant called the 617. It has come into a little limelight because Anthony Fauci has actually said that the Covaxin is good for this. Now this 617 actually has two mutations, which is 484 and 452. I don't want to go through that name. And there is a Brazilian mutation, there is a South African mutation, and lo and behold, post Kumbh and Bengal elections, we may yet have a 4 times mutant, a quadruple mutation, which may come from Bengal. Whatever be the results of the results which may come, I do not know if you're following it. I am not, but I am only sorry to say that Delhi is 2 weeks behind Mumbai. Bangalore is a week behind us. They are already at 25,000 cases a day. Hyderabad may be a week behind them. They are rising. And Calcutta, which has got even more overcrowding, maybe 2 weeks behind us, but it is sure to hit us. Can vaccines, the variants evade vaccines? We do not know the answer perfectly, but Anthony Fauci tells us that the Covaxin and to some extent the Covishield is good enough for 617 variant. Those are overwhelmed. It is a very, very depressing sight. And we have to understand, but there is something in this statistic, if you would like to read. I'm neither a sephologist, I'm neither an astrologer, but I know when the graph goes in very sharp, it is our COVID inappropriate behavior that has kept it at a plateau. But I am hopeful that the graph should come down very fast, because very rapidly mutating virus. It should mutate out of this infectiousness and seriousness of causing crippling illness. So we know that the healthcare infrastructure in government hospitals doesn't exist. I think Anupam was reading my CV. I have the unique distinction of having worked in the armed forces, various corporate hospitals of various use, and also a government hospital. And this can largely be because I think the truth is not a desirable commodity, except in times like this. So I know for sure that government hospitals do not have the bandwidth to be able to deal with it. They have not been galvanized. This needs to be done with military precision. In war, what we do is triage. We only give admission to those that we can salvage, and for those whom getting into hospital or getting into a procedure will help them save life or limb. That is the process of triage. It started by military doctors. Now, unfortunately, it is aap kisko jante ho, and even the Supreme Court has said you're left to your own resources and find a bed. So everybody who knows somebody, people with 98% saturation are occupying beds, where people with 70% saturation. There are heart-rending stories. I can weep 10 times in a day when I hear them, that people dying in cars because they could not get an oxygen cylinder. Maybe your BNI can help with those efforts to do that, because it is not possible for us to streamline this country. Is this not anarchy, I ask? I'm not sure. I'm not a politician, so I don't want to get there, because the governments have permitted people to continue with their religious frenzy. I am also a devout practicing Hindu, but I believe in syncretism. I believe in all religions, and we should have cut down on these electioneering wedding parties. One poor DM of Tripura, who's from my college, went in and his WhatsApp video where he jhapped a pandit, and he had to not only tender a resignation, but he's suspended. Now it is this devastating outbreak is driving the whole global coronavirus surge. There are some states which are going to be done, which are going to have it now. Some are going to have it later. Well, one of the things which I want to point out, because many of these, they work amongst us, are COVID idiots. What are these? They don't believe in vaccine. They don't believe that coronavirus exists. There are many videos of people who say this is all. If they have fever, they think it's a minor flu. And then they think every fever can't be COVID. Then they get either a PCR or a CT scan done very early and say, I told you, it is normal. When fever continues, somebody tells them to get a typhoid test done. I still have people telling me, I first had typhoid, now I have this. No, madam, you did not have typhoid. Your typhoid reagent is showing a false positive result, as is known with coronavirus. Then you start some crazy antibiotic and think it will take 2 or 3 days to get better. But when your oxygen starts dropping, that time you get a PCR done, and then you start exploiting whatever resources you know, all the important people you know, you find their numbers, you ring them up, you ring up their OSDs and staff officers, you say, please, please, please help me get a bed. Then you are trying desperately to contact black marketeers who will say, okay, I can give you remdesivir for 90,000, 1,50,000 rupees. I can give you tocilizumab. People are hoarding this. People are buying and hoarding oxygen cylinders and concentrators. Pata nahi kab use karna padega. Then you somehow get to a hospital, get a bed, but it is too late. Ab pachtaye hot kya, chidiya chug gayi, Kate. You go to a ventilator, and everybody else starts blaming doctors and starts blaming, wahan to clean nahi tha, wahan to doctor ne dekha nahi. Koi doctor jo COVID ward mein kaam kar raha hai cannot come and pander to individual questions. Last night I told you my aunt sent me a message that her granddaughter saturation has come down from 98 to 97, and she was panicking. Then people even start resorting to violence, and then the life cycle of this COVID idiot is to be repeated. I'm sorry, but there are many of this. We have to be mature. We have to be calm. We know that there is pandemic. We know it has been on for a year. My father told me last evening, why should I wear a mask? I can't breathe with a mask. I had to beg him. He said, no, this is not worth it. We have to explain to especially the elders who don't understand patiently that you have to do simple relaxation exercise. You have to eat well. You have to do your exercises. You have to manage your stress. You have to do self-care, set up a routine, even your work from home, practice gratitude, pick up a hobby, maybe see Netflix, get yourself vaccinated. And now some questions on treatment, because I've taken a lot of your time. There are a lot of misgivings. Arrange kar do, kahin se remdesivir la do, kahin se tocilizumab la do. Again, I'll take you back. In this stage, we don't give steroids, but in this stage, steroids and blood thinners are mandatory. So, and in this stage, you definitely need a hospital. If you can get to a hospital, even in this stage, so that things can be managed, your oxygen, when it starts dropping, needs to be supplemented, and you need to take this treatment. So I will give you some tips of how to manage it at home. Do not self-medicate. I have nothing against these CARA and all this stuff because they've never been validated or tested. Use crocin, it will bring down your fever. If crocin cannot contain it, you can repeat it every 4 to 6 hours. If it does not contain it, you can use Meftal or mefenamic acid. Stay adequately hydrated, drink water. As soon as you feel unwell, very importantly, do not panic, isolate yourself, contact a physician of your choice. You can take my number if you want. Your oxygen levels, invest in a good oximeter. Now this oximeter has many things. You know, you can't apply a dense amount of lipstick nail polish and you use the oximeter, although surprisingly it still works. Monitor your temperature and don't only use an infrared thermometer, because some of them are all chal gaya to chand tak, nahi chala to raat tak. I'm sorry, products which are being sold and people are buying. And wear a mask even at home. Sensitize your other family members that while you're isolating, ventilate yourself, wash your hands, and clearly take care of yourself and your family members. But most importantly, don't panic. All the black market surge has been driven not by less by sickness and more by panic. Now, when you get a PCR, when should you do it? Day 5. Ideally, if you've done it on day 2, got a negative report, I've explained to you why it may not be good enough. You will get a CT value. Now, this is not the same as your CT scan report. Like I told you, the PCR runs cycles. If the virus is abundant, then it will come by the 15th cycle. If it is very little, it will come after the 25th cycle. So less is more here, but we don't realize that and we kind of panic on this. And it is not the same. This CT score is cycle threshold. It comes on your PCR report. It is not your CT score, which comes from computed tomography. Self-isolate, avoid panic. 85% will have mild disease. Nutritious diet, gentle exercise, don't work out. Some people are stupidly working out. That will make the virus progress. Oral fluids, arrange your oximeter, monitor your temperature, inform your doctor of any previous medication, especially if you are on, you've got rheumatoid disease or you're a joint disease and are getting some, or you're a cancer survivor and getting some immunomodulating agents. Inform them you're diabetic. Inform them if you're on blood thinners, you've had a stent and you're on antiplatelet drugs, or you've had a valve change and you're on blood thinners. Inform them. Maintain a simple log. Temperature, saturation, pulse, very simple, 3 times a day. Keep your oximeter and thermometer by your side. Take medicines, but don't self-medicate. You can take crocin, you can take all your supplements for immunity. Zinc, 50 milligrams a day, vitamin C, vitamin D is fine. We owe it to this man who unfortunately, Takuyo Aoyagi, who died at the age of 84. He's the one who invented the pulse oximeter. Unfortunately, he also succumbed to the coronavirus. If you have to look for these medical signs: difficulty in breathing, a drop in saturation below 95, below 90% is a little more alarming. Persistent high-grade fever. Fever can continue for 12, 14 days, but persistent high-grade hectic fever with severe cough, mental confusion, disabling body aches, you should know that if your saturation is going below 95, you need to take supplemental oxygen. 1% or 2, don't bother. But if it is a definite trend, because people ring up, वो थोड़ी देर के लिए 89 था, अब वो फिर 94 हो गया, then believe it is 94, you are not taking it correctly. But those who are high risk, like lung disease, diabetes, and heart disease, high blood pressure, oxygen may be required early. We can improvise and set up a tele-ICU using your tablet, even in the comfort of your own homes. Again, I'm going back. Here you're monitoring oxygen saturation. The virus is replicating, so we are avoiding steroids at this stage. The inflammatory response is being mounted. At this stage, we want to suppress the inflammatory response. We will give you steroids. Yesterday, one educated dental surgeon called me and she had started her steroids here. Inappropriate and knee-jerk reaction. I tried to explain to her, she wouldn't understand, because unfortunately we are also communicating over Zoom, Skype or phone. So at this stage, definitely look out for whether you need blood thinners, you need steroids, and you need oxygen. By this stage, you need to escalate it to being into a hospital. A lot of drugs have been tried, and I don't want to take you through their risk benefit. Remember, your PCR done in 5, even if it is done on the 5th day, may be negative because only 67% are going to be positive. The diagnosis, if PCR is negative, you can use a rapid antigen test, although it has only 50% sensitivity or specificity. If your rapid antigen test is positive, also do a PCR, but presume that you are COVID positive. If your CB NAT is positive, do a RT-PCR, but presume that you're COVID positive. If you have typical clinical symptoms and history of contact with a known COVID positive, presume, and a loss of smell, presume you're COVID positive. If you get a CT which is suggestive of COVID pneumonia, although I can share with you, I once had a patient who had an atypical pneumonia, which was non-COVID in the beginning of the pandemic, which can also happen, but we have to err on the side of being more safe rather than sorry. Loss of smell is equal to RT-PCR. Normally, the virus stops replicating after 9 days. 15 minutes of exposure in a close confined space is enough to get this infection. Now, this is a standard kind of thing which people give. Even I give it, one antibiotic, crocin, vitamin goggles, vitamin C, zinc, vitamin D, ivermectin, which is actually an anthelmintic, which is a deworming agent, can be given. It's a very weak antiviral, can be given after dinner for 3 days. For contacts, it can be given 1 dose of 12 milligram. If you are having allergic or coryza-like symptoms of Monterre, and if those who are in the first phase, there is some data from 1 or 2 trials that using a butamate puff, but when you're using a puff, use a spacer or use a nebulizer and rinse your mouth. I don't want you to get oral thrush if you leave all the steroid in your mouth and not take it down into your lungs. You do some tests, and we do some tests like C-reactive protein, LDH, D-dimer, ferritin, and blood count. We do this, the C-reactive protein, IL-6, ferritin, help us to see if there is an inflammatory component. The D-dimer helps us to understand if it is a procoagulant state, and LDH tells us how many cells have kind of died. So when we do this, we actually chart it, and we maintain this. When CBC, we assess something called a neutrophil lymphocyte ratio, but I don't want to go through jargon. CRP, D-dimer, diabetics are important because many of you are pre-diabetic, but when you're taking steroids, your sugars will come sky high. And in moderate to severe cases, CT chest, IL-6, ferritin, LDH, and if you have compromised LFT, KFT, you should do them. CRP is a good marker to start steroids. NLR or your blood counts are a good prognostic factor. And if your lymphocytes start depleting, it indicates that your disease is getting severe. D-dimer needs to be repeated every 3 days. LDH is a useful follow-up parameter because it is indicating it means more cells are dying. IL-6 is quite unreliable, and low platelets can be seen in about 20%. So we put them as mild, moderate, severe, considering the clinical profile, how unwell you are, your saturation, your report, and your imaging, if at all. So features which suggest pneumonia, high fevers beyond 101, very rapid rise of CRP, persistent cough, and if your SpO2 after 6 minutes of walk falls by 5%, it is a sign that needs you to take note. If your temperature continues to be 103 without paracetamol, 101 after paracetamol, and maybe mefenamic acid, persistent cough, shortness of breath, and your CT score is more than 13, CT chest score. Now here it is a computed tomography score, and this is to estimate how much of pneumonia you have. And for this, we do a CT scan. And this again, if it is done in the first week, it is useless because at that time pneumonia has not happened. It is when you have pneumonia and you want to estimate how much the pneumonia you have that you do this, or you're in diagnostic confusion. Don't order it yourself. Let your doctor order it. Because if you order it, it will be ordered at an inopportune time. The people who are doing it will be very glad to do it because they would like more people to have it done. But we can be more sensible. Then this CT is now, there is a score which radiologists like my wife or other radiologists, you even have an artificial intelligence software which tells you less than 8 is mild, 9 to 15 is moderate, more than 15 is severe. But please, for heaven's sake, this is not synonymous with the RT-PCR CT score or the CT level, the cycle threshold level which was there at that time. You must suspect a cytokine storm if you have unremitting fever, which is extreme with weakness, fatigue, shortness of breath, especially sudden. High fever onset in second week is a bad sign. My wife's cousin has right now had a high fever onset in second week. If your counts fall, with every viral fever, you get some amount of neutropenia. But if your sudden neutropenia, it is bad. If your ferritins are sky high, it indicates a severe disease. If you have a CRP which rises above 50 or your CT worsens, you have to think of a cytokine storm. And if you can give some antiviral, we start, once you have a CT positivity in people at home, we start favipiravir. And yes, the dose is 1800 milligram twice for the first day. And if you are using 200 milligram tablet, please calculate. Don't ask your physician again and again. Aapka matlab 9 goli leni hai 2 baar. I repeat, 9 tablets twice a day. Don't do it. Just calculate. You can do simple maths. This is 200 milligram and the dose which your doctor has written is 1800 milligram. Figure it out. But if the fever continues or decreasing saturation, we get these tests done. If it comes below 94, everybody with a saturation less than 94 needs to be on oxygenation, needs to be on steroids, and probably hospital. Many questions are asked. Which concentrator do I buy? And yesterday I did not have this slide when I was making this presentation. But you have to check the specs of the concentration. Don't get scandalized by 90% to 30%, which means if 90 to 30 means that 90% is oxygen is available only at 1 liter flow. And if you have 2 liter or higher flow, it will drop to 30%. The room air has 30% oxygen. So what are you gaining? So preferably, you should have a 20 kilo and above oxygen concentrator, which will have a large compressor, which can give an output of 90% oxygen from 1 to 10 liters, which is important for COVID and critical care patients. You can also use a 90% oxygen at flows from 1 to 5 liter. This may not be good enough for non-invasive home ventilation, but at least will tide you over the crisis till each time you can get to a BiPAP, CPAP, or high flow nasal oxygen or ventilation. You must understand that we do get a procoagulant state, and the clots can form in the veins. They can be in situ clots, which can form in the lungs, which can form in the heart, which can form, you can get strokes or you can get deep vein thrombosis. And for this, we need to give blood thinners. Now, if you're already on blood thinners, I had a 93-year-old gentleman who was getting 4 blood thinners. And because they consulted different doctors, please continue, identify one good doctor, stick to him. He should preferably be an internist or at least have reasonable bandwidth. You can determine that very easily to be able to treat this illness. No doctor can get you a bed in the hospital. No doctor can get you oxygen or oxygen concentrators. No doctor can get you remdesivir unless you're in a hospital. No doctor can give you tocilizumab. The powers of doctors have been reduced tremendously. So you need to understand that there are different stages and we need to act differently at different stages. If your D-dimer is high, we will start anticoagulation. If you have inflammation and we cannot give you steroids, we give you colchicine. If we can, we give you steroids. Any steroid is good. Although the recovery trial was done with intravenous dexamethasone, you can use methylprednisolone orally, you can use prednisolone, you can use omnacortil, you can use anything. If you have persistent fever, progressive desaturation, more than moderate CT involvement, any complication, unmanageable comorbidity. My friend's father has got early dementia and she can't manage him on her own. So this needs IV steroids, remdesivir, ventilation, tocilizumab, find a hospital bed. The Supreme Court has said has acknowledged that there is anarchy in this country. It has acknowledged that you have to use your sound done, bathe, find your resources, find a hospital bed. This is a steroid responsive disease, but we don't give it here and we give it extensively here. Please don't self-treat. What about plasma? There have been a lot of contradictory things. Again, the plasma, the government has given clear guideline. The plasma should be of a person at least 14 days after symptom resolution. Most blood banks want to deal with you only if you are COVID negative. You have to screen out some bloodborne diseases, and your IgG titer should be more than 1 in 640, or you should have at least 13 absorbance unit or a neutralizing antibody titer of 1 in 80. And this should be used as early as possible. It decreases the severity of disease. It gives you ready-made antibodies. We don't know how long they will last. And you must be sure it is clearly said that men and unmarried women, that means who've never been pregnant, that's a social issue, I guess, can donate the convalescent plasma. The trial, the Solidarity study said actually it has no role, but it has role in some cases if used appropriately and used early. Let your doctor decide. Remember, your oxygen is a precious drug. Don't try to achieve an SpO2 of 110%. Use it to maintain a saturation of 92 to 94%. Use it judiciously. I get a lot of calls in the middle of the night. My concentrator stopped working. I'm not a biomedical engineer. I just tell them, switch it off for 10 minutes, switch it on. 80% of the time, God willing, it starts working again without any further interaction. If you are getting desaturation, not able to find a bed, this is a simple thing you can start at home. And that is to encourage people to lie on their tummy. The problem is that people who normally sleep on their tummy, when you tell them to lie on their tummy, they think it is a very difficult thing. It actually makes sure that your ventilation improves. It keeps your alveolar units open, breathing easy, and decreases your hypoxia. What it needs is you need to put 2 to 3 pillows under your hips, 1 below your neck, 2 below your shin, and that will allow your tummy to expand and will allow the diaphragm to kind of work better, and also allow the alveoli to open and different alveoli to open. And this is something we learned from critical care units when people who were difficult to extubate were extubated after a trial of proning. So this is how we do proning, and it can be done at home. If you get tired after from 30 minutes to 2 hours, try at least 30 minutes. You can lie on one side, then on the other side, then again go back, and you can even sit up for a couple of minutes and then do this again. Do this as much as you can, because your hospitals are in short supply, and this can help you even avoid going to a hospital. Avoid proning if you're pregnant, if you have deep vein thrombosis, major cardiac conditions, unstable spine, femur, or pelvic fractures. It can be done even in the hospital. So that, ladies and gentlemen, was the overall picture of how to treat it. But if you recover, well, what do you do? When do you end isolation? The government said that because the virus replicates from 2 days before you become symptomatic, so from the date of testing positive or from the date of symptoms, it initially said 18 days. Now, if it says that if you were just asymptomatic and you were COVID positive, which is going to be 50% of the people, you can do it 10 days after the positive test. If you were symptomatic, then you take 10 days after symptom onset plus 3 days when you have had no symptoms. So about 14, 15 days. So I normally tell people this rule: if you have had symptoms and you have had more than 10 days since the onset of disease, if you have been asymptomatic for 3 days, it is okay to come out of isolation. Some people ask, and I am sure even after my saying this 2 times during this presentation, it will be asked again, loss of taste or smell may continue for weeks or months. It does not delay your end of isolation. So while your loss of taste was important to diagnose and start treatment, loss of gain of taste is not important or mandatory to end isolation. Do you need a retesting? Well, the government initially had limited resources and said, no, not required. We know from the natural history that you replicate viruses for about 9 to 11 days. So in 14 days, it's not really required. But if you have high-risk family members and you think you could be transmitting infection to them, please go ahead and do it. Again, I repeated this just so that it is a point which is made. Now, there are different discharge criteria for different people. We don't really need a negative swab at the time of discharge. We see the time frame. We advise home isolation, but we continue to advise self-monitoring and post-COVID care rehab. Now, the rehab has to be done at multiple levels. This is a multi-system disease. If you are advised blood thinners, they normally are continuing for 4 to 6 weeks. Your steroids may stop in 5 to 7 days, but you need to monitor yourself at home because you can get what is called the long COVID. I will describe it in a minute. And you need to build your lung capacity. So incentive spirometry, try and make and push those 3 balls to the top. You may be protected after getting infected once, but only for an unknown period. A question which is asked is, doctor, I took my first Covishield, then I got COVID. Now I have recovered. Do I need a second Covishield dose? Yes, you do. When do you take it? Take it at least 4 weeks after your recovery. What about Covaxin? Yes, you do. You still need it. When do you take it? Take it 4 weeks after recovery. In Covishield, you have an inherent advantage. You have a 12-week in which this 4 weeks should get done. But in Covaxin, even if it exceeds the 4 weeks, still take it 4 weeks after you getting recovery because your infection itself would have caused some memory B cells to be created. The big 5 to recollect for treatment are diagnosis, isolation, avoiding panic, fluids, oxygen, antiviral. If we start oxygen, we are meant to give remdesivir, but we don't have it. So government has said remdesivir in hospital. Anti-inflammatory, if oxygen started, we must give steroids. Anybody saturation less than 94, give steroids. In the first week, we avoid steroids, but it's very difficult because they all merge. So let your doctor decide. If you decide on anticoagulation, prolong at least for 4 to 6 weeks, that it can happen. Yes, there will be some sudden deaths. We had an important news anchor who passed away suddenly, and a lot of blame game is going on. There's a PIL already. Now, because 78% of the virus involves the heart, there can be abnormal rhythms, there can be slow heart rate, which is known to happen with viral fevers. There can be high heart rate. So bring this to your doctor's attention because very often the doctor is not coming and examining you. He's asking you for details. Bring this to his attention. He will tell you what is to be done. Although 78% have involvement of the heart muscle, they don't always get heart attack-like features or they don't always get heart failure-like features. So remember that and remember that proning is a very invaluable tool. Here's an 82-year-old woman who recovered after using proning techniques along with supportive measures. Government advises you to wear a mask at home also. And I've explained to you why it is important. There are some good efforts. Here is a doctor who became a district collector of Nandurbar, whose district did not go through this oxygen crisis because he got down to setting up liquid oxygen plant in the district just after the first coronavirus incident. But the government is now reacting a little bit too little, too late, maybe, but it has allowed you to, your family and friends in the United States or other parts of the world can send you a concentrator. They can FedEx it to you. FedEx has not waived off the freight charges, but the government has waived off the custom duty. Oxygen-related equipment. They asked why I was one of the people who was asked. I said, put all related equipment because we don't know what all is going to be used. The transportation has improved, and today's headlines should not ever happen again. Yes, some people will get low energy, early fatigue, difficulty in breathing, chest congestion for some time, maybe headaches, lack of concentration. Take your time, combat this anxiety and fear. You can take some melatonin if it helps you sleep, and try to avoid becoming a benzodiazepine addict, which is taking Alprax, clonazepam. Avoid it. If at all, take something natural like chamomile tea or maybe melatonin. It should be good. And get yourself vaccinated. So Anjali asked me to something I referred to yesterday. The vaccination for under 18 has opened so that the Rekha Jaya Bachchan interaction, which has become very viral and coronaviral on WhatsApp. I don't have that slide, but apparently Jaya Bachchan very politely asked Rekha ji, aapne vaccination kara liya? And she said, nahi, mera to first May ke baad hai, signifying that she's above 18. Now above 18 can also have vaccination, and can only stop COVID appropriate behavior when most of us or all of us are vaccinated. Till such time, COVID appropriate behavior is mandatory. Let's get this thing straight. This virus which kills, for which there's no cure, can be killed by sanitizer and liquid soap. There are 3 golden rules: masking, washing hands, distancing. and it has only taught us that stupidity travels faster than any virus on this planet. And what we should realize is that my own common sense and my friends, colleagues, families' common sense are all related to our surviving. We are scared of getting fined. We fight with the cops, but we are not scared of getting infected and landing up on a ventilator. So two things are spreading coronavirus: how dense the population is and how dense the population is. Let us follow COVID appropriate behavior, encourage others to do the same. I don't have to repeat it. Make sure that you're vaccinated and follow COVID appropriate behavior, because ignorance is not bliss. It is the kiss of death. And remember, rumors are carried by haters, spread by fools, accepted by idiots. This is from yesterday's newspaper. While the press was lamenting the loss of their 41-year-old senior news anchor, very popular, handsome, smart news anchor, very articulate news anchor, who succumbed to this illness. The Chief Secretary of Bihar succumbed to this illness. Soli Sarabji succumbed to this illness. Pranab Mukherjee succumbed to this illness. Our Dr. Padmavati succumbed to this illness. But we have no bar. Gurgaon is likely to see 300 weddings in the next 15 days. So, ladies and gentlemen, wake up. Let's walk the talk. Let's be intelligent. Let's be empathetic to others. If not for yourself, for the sake of your loved ones. If not for their loved ones, for the sake of this talk. Spend less time on things which you cannot control. I cannot control Bihar elections. I cannot control government policy, economy, social media, vaccine availability, infrastructure, news, politics. I cannot even control Kieran Pollard scoring some 85 odd runs and 25 or 30 balls yesterday. I cannot control. I do not even watch it. What I can control is focus here. I'm spending my time educating friends like you. I am declaring my availability. I can, in the chat box, write my number, or you can take it from Anupam or Anjali, or you can take my mail ID. I will respond 24/7. I told you last night, I had at least 25 calls from the time that I slept. And when I slept, I had a niggling cough. And I thought that, hey, I should not be starting this. So I have kind of isolated myself. Eat healthy, limit your social media exposure, keep doing some physical exercise. Don't become a couch potato during this time. Don't socialize. Only the Bollywood is authorized to go and post their bikini pictures from Maldives. We will enjoy the bikini pictures. Have mindfulness, have meditation, have gratitude. You're a survivor. You're meant to survive. Have positive thinking. You're meant to make your family survive. Take all precautions. Encourage people to get vaccinated. Help others. Join in this effort. Source oxygen. Hopefully, we will come to a more manageable number in 10 days or 15 days. But if we don't, I fear that the worst amongst us will surface. The black marketeers, the racketeers, the profiteers, these people who are ruining the name of the human race, because we may keep being xenophobic and blame China. And we can think that Corona was born in China, grew up in US, studied in Italy, set in Brazil. But do we want it to become a successful, in inverted comma, businessman, racketeer, profiteer, black marketeer in India? We don't. A question I'm asked, when will life return to normal, doctor? When can I go and play tennis? When can I go and have my kitty parties? Unfortunately, ladies and gentlemen, I'm a physician. Actually, I'm an interventional cardiologist. I've taken this time because I feel it is the need of the hour, and I'm not doing too much of cardiac intervention today because the labs are shut. We are only taking emergencies, which are life-saving or life-threatening. So I can spend this much time to prepare this kind of talks and to deliver them to people like you, hoping that I will be the change. I will make sure that you all are all instruments of this change. When will life return to normal? Either GOK, God only knows, or the virus. We have to pray that the virus mutates and the virus will set the timeline. Till such time, we have to be prepared for this virus personally, individually, as a family, as a society, medically, infrastructurally, logistically, every which way. We can stop thinking about financial gain. Even the AIMS director has pleaded with the government. Anthony Fauci has recommended to the government to declare a lockdown for the next couple of weeks. Let us ride this thing over. We hope. We don't know if lockdowns work. I do not know the political angle to this. But I want a circuit breaker any which way, because we can't vaccinate everybody just yet. We can't admit those who are sick. We can't do all this. We can help others. I must compliment all those NGOs and all those people who have put in oxygen lungers, who are distributing food packets, etc. Join in the effort, friends. Let's fight this virus together. Let's point out to the virus that we are a human race with humanity, and let's bring the good aspects of humanity. Let's not despair about the bad aspects of humanity. If there are any questions, I'm sure Anjali and Anupam will coordinate. Thank you for a patient listening. Thank you.
Thank you so much, sir. Yes, there are questions. The first one I saw, sir, was, do you lose weight because of COVID? And she again asked was that what should be CT scan from first one to the second? What should be the time duration for a repeat CT scan?
Firstly, you can lose weight because it's a serious illness and you can lose weight. However, because of your steroids, don't be surprised if you actually gain appetite and weight either. So it all depends on the stage of disease. If you're on a ventilator, and I have had colleagues who have fought a ventilator, fought a extracorporeal membrane oxygenator and come back. So those are patients who've lost a lot of weight. However, and you can lose weight because of any critical illness, but because of steroids, and if you're at home and if you're eating a lot, you can actually gain weight. So here is a complete spectrum. And for the second question, when you repeat a CT scan, may I request you to leave that? Don't play doctor. Don't play Dr. Webinar, Dr. Google, Dr. WhatsApp, or Dr. Telegram, Dr. Signal. Let your doctor decide. And normally we don't like to do a second CT scan because after all, it is radiation and we don't like to unnecessarily burden the overburdened system already. So if you are recovering, we don't like to repeat a CT scan. If there's some cases who are either worsening, we may, and the first CT scan looked quite innocuous, we do like to do a second CT scan. Some people develop some amount of pulmonary fibrosis, and you have heard of lung transplants happening, in whom we need to do a couple of follow-up CT scans. So leave it to your doctor to decide, and that I think would be the easiest solution. Please don't do it yourself. I hate this when CT scan reports come with prescribed by self. So that is not a very good thing. It should be changed to being prescribed by webinar, prescribed by Google, prescribed by WhatsApp. Let's not go there, friends.
May I request you to stop sharing the screen so that we can see everybody on this? Thank you, sir. Yes.
Yeah.
So the next question is there any correlation between intensive COVID-19 care and varicose veins? What precautions should people with varicose veins take regarding COVID medication?
Varicose veins actually is not such a big deal. But if you have deep vein thrombosis, then number one, you may have been on a blood thinner, which could be one of the oral anticoagulants like dabigatran, rivaroxaban or apixaban, or maybe another oral anticoagulants, which are blood thinners like vitamin K antagonists, which are drugs like acetylcysteine or warfarin. If you are on these vitamin K antagonists, then you need to be sure about your INR, because your INR has a lot of drug and drug diet interaction. Whereas you should tell your physician that you're on these drugs. But varicose veins per se don't have anything much to do with COVID disease. You can get red toes, and you should not think that they can be COVID toes. But we have seen that very infrequently in India. They've been reported largely from the Western population.
Then the next is, does air purifier help in any way to clean the air in our own homes? Can the virus enter our car if we switch on the car AC? Can I walk on my terrace without a mask? Does pranayam help once we are infected? And continuing to this does the split air conditioning in a private residential apartment pose risk from outside environment?
Well, if you ask me so many questions, I'll probably answer the most convenient answers that I don't. But I will tell you, I will start by taking them down bit by bit. So I referred to my wife's cousin. And 2 days ago, I was finding some strange noises when I was doing a teleconsultation with him. I said, what are you doing? He said, I'm doing pranayam. I said, what's your saturation? He said, 88. I said, what are you doing? I said, hey, listen, that's not going to help you. Why don't you just lie on your tummy? I've told you to prone. I've told you to use your concentrator. He said, no, I read somewhere that if you do this, it'll help you. I said, what is it doing? He says, it's making me dizzy. I said, obviously you're hyperventilating. You're washing out your carbon dioxide. And because you're doing that, now you're getting tingling sensation in your fingers and toes. He said, that's right. I said, please stop doing it. So pranayam may be a good thing to build your lung capacity before you get really sick and after you're recovering. There, I have no contest with it. But while the time you're sick, proning would be the way to go because there is some demonstrable benefit. Deep breathing, I would not say is a bad thing, but using, just doing pranayam, and many of these people are doing it without knowing how to do it, is not such a good idea. I have issues about using a common air conditioner. Many of the high-rise buildings have common air conditioning. The office spaces have common air conditioning. So it's avoidable. In a car, I would avoid using an air conditioning, especially if I have a driver who is driving me, especially Ola, Uber, despite them pulling those polythene. Then I would, if I have to use that, I would keep the windows open. So I wear a mask in the car because my driver drives me, and I wear a mask and a shield. He wears a mask and a shield, and we keep the windows open. We have not switched on the air conditioning. Okay, the third question was a split air conditioner from outside. Well, like I told you, unless there is somebody coughing into your, it should not be so much of a problem. But if you have very high density, then we need to have air circulation. So among the air quality improvement exercises, it is not just having a domestic level air purifier, which may be enough. That may decrease some ppm, the parts per million in your air purification, but may not decrease your viral load. And the second thing is that cross ventilation is more important than using these humidifiers. So humidifiers are good. They are not bad, especially when you have very highly polluted environment, as happened sometime when the industries opened last year, and definitely happened in 2019 before the coronavirus pandemic. So all of us acquired those purifiers, but whether they protect us even from coronavirus, the answer is I don't know, and I don't want to venture into places which I don't know. I think one by one, I have answered most of your queries.
Yes, walking on the terrace without
walking
a
on
mask.
the terrace. Well, if there's nobody else, if you are not secretly romancing your neighbor's wife who's also walking on an adjacent terrace, and you're coming close to 6 feet, I guess it's okay. Yeah.
So when should medication you mentioned be started? Now somebody is playing doctor.
Again, so I am again requesting you not to play doctor. I would say confine yourself to taking kerosene and these vitamins. That is a good idea, but beyond that is not such a great idea, because then suddenly things will go out of hand, and nobody will be there to even guide you appropriately. And you may have done something wrong. One of my professional colleagues, a dental surgeon, she heard it's a steroid responsive disease. So the first instance, her husband tested positive. She started steroids for herself. Now, unfortunately, this country, every damn drug is over the counter. Our pharmacies the pharmacy license comes for a qualified, certified, registered pharmacist. But the pharmacies are being run by Chotu and Raju and Deepu, who were actually GDAs, who have no difference between Hygiene and digoxin. And today they are doling out Fabiflu, they are doling out steroids. I shudder to think. Let me also tell you, a lot of people, even in the first surge, developed complications of steroids. A lot of them. And I was talking to my friend Vivek Sena, who is an ENT surgeon. and he has operated people for mucormycosis, which is fungal infections of our sinuses, who've had this because of ad lib, unadulterated, uncontrolled steroid usage, especially among diabetics. So I would recommend that please don't play Dr. Dhall. CT scan score is 9. Somebody's asked, well, it is mild, but it depends on when you have done this CT scan. If you have done it in the first 3-4 days, I have a colleague's father who's right now about to go on a ventilator. He's on high flow nasal oxygen. He was in Hapur, he got his CT scan done on day 3 and informed me, Doctor Sahab, koi chinta ki baat nahi, hamara to mild hai. And I kept asking him, when have you done it? You know, CTs, we have had some national leaders, I will not take their names because it's inappropriate, and unfortunately we've lost them, whose CTs went up with a almost moderate CT, they still had a fatality. So disease can progress. Let this be done under medical supervision. Let's not play doctor.
So models of oxygen concentrator, please.
I have given you this time around. I stated yesterday, Anjali and Arpam heard me saying that I'm not here. I'm not a film star, so I cannot be a brand ambassador for any one of them. The availability is a major issue. India was to fly in a lot of oxygen concentrators from China. Then I think China Airlines stopped its freight flight, or even the FedEx cargo flights have stopped which are coming in directly from China to India. So a lot of these concentrators have been moved from Shanghai to Hong Kong, and we are expecting today, tomorrow, and day after at least 1,500 concentrators to land. People are arranging concentrators themselves from places like Turkey, Italy, and United States. Some people have arranged it from Dubai. So it is a good idea to arrange it. I've given you the landmarks, and it may be a good idea to recap that slide because I don't know the names. It is not my domain expertise. I cannot tell you this one is good or that one is good. But if you are just wanting to treat a COVID patient at home, then it should at least be able to deliver a significant amount of oxygen. I'll go back to that slide if you want. At least I'll open it for myself because I will also have to, check. But at least a 10 kg oxygenator or 20 kilo oxygenator can serve 2 patients. So you can have, even at high flow, it should be able to deliver a high percentage of oxygen. Now, what is most of these are humidifiers, which are being sold as oxygenators. Be very careful about that. So check when the oxygenator is delivering you 5 liters per minute, it is still delivering you 90% oxygen. If it delivers you 30% oxygen at 5 liters flow, then it is just giving you air, and it is a waste of money.
Thank you, sir. Time lapse between sample collection will affect results, like sample collected on 19th reaches the lab on 21st and results on 22nd.
Ma'am, I will just say, have some compassion for people who are running these labs, and have some compassion. The government has capped their prices. They have not been able to do surge pricing. They have not become smart businessmen and made money. However, they are serving the public, and large amount of their technicians have fallen prey to this infection, and they have to go through their process of isolation, quarantine, and return to work. So they need a significant amount of people to either collect samples and do these technical tests. Yes, it affects us, but it is not just their problem. It is everybody's problem. And unfortunately, for everybody's problem, we pay taxes. We're supposed to have a government which should have done something. But I think, to be honest and fair, everybody was caught with their pants down. And it's very embarrassing to be caught like this, and we have to bear with it.
But I've been to Hyderabad, and my brother tested positive. We came back on 16th April, isolated. Till date, I have no symptoms. Can I go for vaccination or go for a certain test before that?
You've been positive, you have no symptoms. You should come out of isolation at least after 10 to 14 days.
No, he wasn't positive. His brother was.
So he was not positive. So,
Yeah.
but he
He
got
did
himself tested.
isolation.
Yeah, but he got himself tested on day 6 or not, day 6, day 7 or not. If he's got himself tested on day 7 and he has no symptoms and he has not been positive, well, then he's not infected. Then he can go and get himself vaccinated. But for his brother, I will, because many people, this is going to be the next question. If you have recovered, I've already told you the timeline. At least 2 weeks is mandatory, but 4 weeks is what is recommended after you recover.
Sir, people are asking for plasma. What should we do? Should plasma be given or not?
You know, firstly, I try to point out that plasma, see, again, understand the time course. People land up in ICU critically ill for whom plasma is mandated rather late in the course of the illness, by which time there is less role for plasma. More than finding plasma, I would say find an ICU bed. If you do need plasma, well, a lot of organizations, the ILBS is running a plasma bank. There are a lot of organizations where people are using social media. And this is one of the good uses of social media. I think it's not bad. I know some people who got plasma on Facebook. I know some people who got plasma on LinkedIn. So there are a lot of NGOs who are working in this space. You have to also deal with your family and friends to help you. There are some blood groups whose plasma is in dire supply. I can't really help more than giving this background information.
Thank you, sir. Steaming hot water, how many times does it really help?
I don't know if steaming helps. There have been, I know it's very popular. I really don't know if it helps. Again, lukewarm water is probably better than very hot water. Very hot water can scald your lining of your throat as it is. And you may get a sore throat and you may not know what to do with it. So I would, even if you were to do steaming or warm water, as long as it makes you feel comfortable, it is okay. But betadine gargles for people who have sore throat, I recommend 3 to 4 times a day. It doesn't really change things, but it makes you feel better.
Can someone who is vaccinated with 2 shots get infected but remain asymptomatic and spread to his family?
I think I said that about 10 times over ad nauseum. Yes, ma'am. You can get infected. You're less likely to have severe disease. So you may remain asymptomatic, but you're still a risk for your family and your community.
So how do we treat weakness while recovering, or we've recovered?
Very, very, very difficult question. The first thing is to overcome fear and anxiety. The second thing is to ensure that you sleep well. So maintain good habits. Third thing is adequate fluids, nutrition. You can continue all these vitamins. I don't know if they help. And just be patient. You will improve. Just be patient. There are no drugs as yet. Once this treatment comes, we will discuss that, maybe in another iteration.
Any medicines to keep oxygen level up, all those who are in home isolation?
Not really, but when oxygen goes down, and so try proning, try and arrange a concentrator. You should be on steroids. You should be on blood thinners. But blood thinners and steroids, for heaven's sake, I know of at least 5 patients whose sugars became unrecordably high because of steroids, because they were not checking their sugars. So when you buy things to help yourself and your family, it may be worth investing in a reasonably good glucometer, a good oximeter, and individual thermometers. IR thermometers have their own challenges, and only very good quality IR thermometers may be used in intensive care scenario. So by and large, there is no drug which drives up the oxygen concentration. I'm not one given to saying, like some politicians saying, that this plant drives up the oxygen concentration. I'm sorry, I don't have knowledge of. And I think proning and appropriate treatment. But remember, if it's deteriorating, you're sooner than later going to require oxygen therapy. Please find a hospital bed. This country, we have the ignominy of the government, of the Supreme Court saying, leave it to the people, let them find it. I think they're saying this because they're realizing that the task is beyond that of any governance, of any government, to find beds and resources for so many people. Sad, it's a form of anarchy, I understand, but we should have developed ourselves better. I'm part of this mess. You're part of this mess. We are all part of this mess.
Walking in society 6 feet should be all right with mask, of course.
Absolutely. In the open, as it is, the propensity to get infected is much less. It is in poorly ventilated closed spaces that the infection possibility is higher. We can develop a risk index and you can just factor it. I showed one slide, but then there was no time to discuss everything in such detail. As it is, I think I exceeded a lot of my time.
So would you recommend any tests further if the RT-PCR is positive even after 14 days of the first positive report for a 71-year-old who has had his first dose of vaccination and now has no symptoms and oxygen is above 94?
Sir, after 4 weeks of recovery, get yourself vaccinated with your second dose. No test, sir. Check your sugars. If you've been on steroids, you should not be harboring diabetes. That's all.
So if the patient's oxygen is fluctuating from 95 to 90, is it good to go for a CT? I think you mean CT scan.
Yeah, but I don't think this is because we are not checking it in an appropriate fashion. So you should be, people are almost trembling when they record their oximeter. So they need to be stable in mind, body, and soul. They need to check it. It should be that the oximeter firstly should be good. So I personally use something from Dr. Trust because I bought a lot of oximeter. This one has stood the test of time. So I bought it on Amazon. I'm not an agent, but Lepu, I believe, is giving a trustworthy, reliable oximeter. Many other oximeters work for a few days, then they don't work very well, or they work intermittently, or they work with these kind of wavering readings. So we check oxygen saturation, two things. One is at rest and one is after 6-minute walk. What we find is, strangely, most people increase their oxygen after walk. That is because they are not really breathing well when they are resting. They are not proning. So if there is a drop in oxygen when you are walking, then maybe a time to consult your physician to see if you need a CT scan. That may be an early warning sign. If there's a drop on walking by 5%. But if you tested it once in a while, it goes to 89, it can be because of an irregular pulse at that time, or it can be because of a poor recording or something else. So you should be stable when you're testing. Don't read too much into 95, 90, 95, 90, 95, 90. Don't read too much into it.
So what are your views about weddings, attending weddings and going to cremations and bereavements now in today's current scenario?
What to say, Anjali? I think your Zoom is a very good tool for people to Zoom. I'm not, again, an advocate only of one of them, but these tools like Microsoft Teams, Google Meet, Skype, Zoom, where you can interact with family and friends. And I think government has made restrictions. We ought to respect them. Please don't try to cheat the government by saying, oh, government has said 100 people allowed. I'll print 2 cards. Huh? I'll take 2 adjoining banquet halls. And then I'll do a standard party with 200 people, but 100 here. Chill, man. Let it be. I think we should come through unscathed, safe after this pandemic. Even if you have to have a wedding, I think a registrar-based civil wedding with a Zoom celebration. My nephew got married in the United States. His parents did not attend his wedding. So it's okay. We have to, if life is to carry on, we have to carry on in a modified fashion. And I mean, I would hate to think that on one side, it's like WhatsApp, school WhatsApp group and college WhatsApp group. On one side, somebody says somebody lost somebody, and everybody says, oh, heartfelt condolences, heartfelt condolences, heartfelt condolences. Then the next message somebody says is, Oh, somebody's wedding anniversary. Oh, party time, party time, party time, party time. Hey guys, people are dying all around us. Quit the idea of celebrating. Protect yourselves, protect your family, protect others. You know, we are not gladiators. I feel sorry for all these IPL people who are playing without in that bio bubble or whatever, just because some big corporate houses and the BCCI has to make money. Are we gone back to the Roman gladiators? How can we celebrate? We should not even applaud a talk or anything. We should not despair. What we have to do is prepare ourselves, be strong. But take this in our stride. But rest is your decision. You're all mature adults.
On the WhatsApp, the latest things doing rounds is virus through the WC in the apartment. Now, how true is this?
Well, there is some talk about the virus being excreted in the stools. How long it lasts, I'm not sure. I hope your apartments don't circulate the WC water elsewhere it goes and it is. So what you can do is you can put some sanitizer powder, whatever, your Kleenex into your pot after it's been used. And do that for everybody. See, these are concerns everywhere, but it is a respiratory virus by and large. So much more than it's spread through alternate means, which can happen, but which will be less. It is this person-to-person contact through your nasal and oral cavity, which are going to be formed. It's a respiratory and oral nasal virus.
How soon can we donate plasma? After, of course,
So 14 days at least after you've been completely and totally asymptomatic. The government does not mandate a RT-PCR negative, but most blood banks do. So they want you to have a appropriate blood group certification, and you can donate after 14 days, and after 4 weeks you can donate again, as long provided you have adequate antibodies.
I did cremation of my relative on April 27th, and I got my second dose of vaccine on April 26th. Now I am scared and have a phobia that I will have COVID in next few days. Can you please help address this issue?
You know something, there is something called immune enhancement. And that is why we recommend that everybody who goes for a vaccination, other than people who have fever, can go. So, but if you are in the prodrome of the illness, you may not know it. And that can be a problem. So what I would suggest to you, sir or ma'am, whosoever this is that day 5, get yourself tested. Till such time, it may not be a bad idea to isolate yourself.
One of the audience got tested for the whole family of 4, where I got negative report, and after having continuous symptoms for 6 days before giving sample, after 5 days of getting vaccinated the first dose, but my wife and 2 kids are reported positive. Was I positive and have recovered? If not, then what is the risk?
So, you know, we read too much into these questions, because 1/3 of RT-PCR is going to be negative. So have a high index of suspicion for reporting of, even if you're negative, and if you have classic symptoms or you have a CT scan which is positive, maybe do an alternate test, or maybe repeat a test after 2 to 3 days, or maybe do a CT scan. And if it is there, it is there. You know, if you hear hoofbeats in Africa, zebras are around you. So I mean, I would really think that one should not try to say कि नहीं मैं बच गया.
Most of the test reports are in the normal range, but they're not getting the CT scan date. So can we delay the CT scan?
Yes, CT. CT chest.
Scan. Yeah.
Yeah. No. This is incorrect. This is incorrect. Because a large number of hospitals have been converted into fully COVID hospitals. See, I'll tell you what the problem is. The public does not want to go to a COVID hospital to get a CT test done. They think they'll get more infected. Now, a large number of hospitals have been declared as COVID hospitals, My wife runs a radiology department. I know that 80% of the time they are doing these CT scans round the clock. The problem is that sometimes when you talk to the call centers in various hospitals, they'll tell you the next date is for 5th of May. I think at that stage, if anybody needs any time, escalate it, we'll try and help. Just escalate it to Anupam. He'll be able to get things done in at least in a couple of centers.
Sir, I have a relative who got COVID after the first dose and then got hospitalized, recovered, and got back. Now again he has fever. How does one decide for this?
And got what back?
Recovered and got back home.
Okay.
And came back home, and now again he has fever.
So here is a point which I did not want to cover because it's depressing, because reinfections, I have encountered at least 4 or 5 clear reinfections during the last year. Reinfections are possible. Mutants can explain something. Inadequate antibody responses can explain something. Early use of steroids can explain something. Virus going, the antigen going unresponded, undetected by radar, so the body can explain something. But reinfections are possible, so you need to get tested again. But don't be surprised if this time around you're negative. And reinfections may happen, but are by and large rare.
So again, blood thinner with steroids. Should we start, not start?
Leave it to your doctor. I mean, we are available. My phone doesn't stop. You can post my number or my email ID or whatever. I think most doctors are not sleeping, although they need to, because they are answering these questions. But you should check with your doctor. He is the best judge. But then you should have chosen your doctor appropriately.
Sir, next is, should I make my my grandma wait for a few days more to get vaccinated? I fear if her health deteriorates after taking vaccine, we won't be able to get a hospital bed. She's taking high BP medicines.
Isn't this an oxymoron? That's my answer. Isn't this an oxymoron? So I'll tell you what I did. And this is from purely personal experience. I get up every morning at 4 a.m. and I review a lot of literature, and I've been following all the tweets and all the publications. And I was seized of the fact that Covishield second dose is best at 12 weeks. I got Covishield at 4 weeks, but for my parents and my father-in-law, I thought I would wait for 12 weeks. But a little before the surge really jumped to these 25,000 figures now, I knew it was happening. We could figure out, because from hundreds, when it became thousands, we knew the surge was coming. So, and by that time, the vaccines, as you know, dried out in most of the centers, at least in Gurugram. So I had to take them to a public hospital in Delhi in the middle of the night, because the Delhi government is vaccinating 24/7. And I got them vaccinated at 7.5 weeks, not waiting for 12 weeks. Because I said, if the surge comes, I want them protected. They are elderly, they are compromised. I come to a hospital, I go back. I carry maybe some virus with me. And like I said, I may be protected myself because I am vaccinated, but it doesn't stop their protection. So I got them vaccinated, the second dose, in the 7th week. So, sir, I know you love your grandmother, and I used to love my grandmothers too. I would be even more cautious, and I would have no vaccine hesitancy in getting them vaccinated. You ask Anupam. I suggested to him a few days ago that although the curfew has been imposed, Go in the middle of the night, I'll give you a certificate. Go and get the second dose of vaccine in a government facility in Delhi. Things may change now. Things may change now, not only because Rekha has become 18 years, but things may also change because from 1st of May, there may be, I'm not sure what they've done with the payment schedules, which are supposed to be there, because till now, government giving free of cost, private funds not allowed to make any money out of it. And they thought it was a good marketing exercise because they thought life is going to return to normal very soon. But I'm not sure what is happening now. There are many more vaccines coming. Like I told you, theoretically, I believe that the Covaxin is a great vaccine. We have data for 81% efficacy. Covishield does have some issues regarding use less than 60 years of age. There's some thrombotic tendency, a vaccine-induced thrombocytopenia and thrombosis, which has been reported, but the incidence is less than maybe 1 in 100,000. There's a Sputnik which is going to be available. There's a Zydus Cadila vaccine which is going to be available. There is most probably we're going to have mRNA vaccines which are going to be available, because the government now has realized that they cannot only run this 130 billion people on just indigenous vaccines. We cannot produce it. So we are going to have more availability. And sooner than later, I know that Bharat Biotech is working on a single-dose nasal vaccine, which may actually start giving you protection immediately, because it may produce some local IgA antibodies and so on and so forth. So there will be some phases where we can possibly improve things. So let's keep this for a second talk sometime. But no vaccine hesitancy. Let's do what we have right now. Sooner than later, it's best to be vaccinated for your good, for collective good.
I'll take the last question for the day today, sir. My wife at 12 days, myself at 5 days. She has recovered and has no symptoms. I still have symptoms. Can we stay in the same room and use common facilities like kitchen, washroom? And can she get infected again as she's recovered and is at the 12th day?
As long as she's not debilitated. Since she has recovered in 5 days better than you, her immunity is possibly better than yours. So it's unlikely that she'll get a second infection. Please wear a mask and stay together in the same place. No problem. So this is logic. This is not a medical answer.
Thank you so much, sir. You've been a pleasure to listen to, and so patiently you've answered I don't know how many questions, and some were very case specific. We are so grateful, and I'm sure the audience and most of our BNI members have benefited, and their friends and family who are with us. And we could.
So you can just circulate my mobile number if it's
Anupam
not.
Anupam has shared
just
it.
Said your assistant's number. So that then he can pass it on to you. So we want you to be free to attend to the.
You can give my mail ID also, because I can reply to emails.
Yes, sir. I'll do that.
So thank you so much, sir. And Anupam, I would like you to do the honors of closing and thanking, sir.
Yeah, just reconfirming your mail ID, sir. Dr. Anil Dhall at Gmail.
Yeah, that's correct.
Anjali, can you just put that Dr. Anil Dhall at gmail.com?
DRANILDHALL at gmail.com.
Thank you, sir. Thank you so much. So on behalf of everybody from Delhi South and their family and friends who joined, I know my daughter-in-law is also here. We would like to really, really, really thank you from the bottom of our hearts for the yeoman service that you're doing, for the time that you're spending, sir, to educate people. I think more than anything, it is the hope that you are giving to people. It is allaying of fears, allaying of doubts, getting out of this WhatsApp university and telling people to trust your doctor, trust your doctor. Yeah, there is no point कि उन्होंने ऐसा बोला, इन्होंने ऐसा बोला. डॉक्टर साहब ने बताया कि जो फेजेस हैं वो बड़े ओवरलैप कर रहे हैं, तो अपने डॉक्टर को ट्रस्ट कीजिए. उनको मालूम है वो आपके साथ क्या कर रहे हैं, सही कर रहे हैं, कैसे कर रहे हैं, क्योंकि वो हजारों के साथ डील कर रहे हैं. डॉक्टर साहब भी कार्डियोलॉजिस्ट हैं, बट वो भी आज कोविड पेशेंट्स के साथ डील कर रहे हैं। एंड मुझे इतना मालूम है, आप यकीन कीजिए, हर डॉक्टर एक दूसरे से सलाह कर रहा है, एक दूसरे से जुड़ा हुआ है, बहुत बड़ी ये कम्युनिटी आपस में नॉलेज शेयरिंग कर रही है। तो कोई भी डॉक्टर नीचे ऊपर नॉलेज में ऐसा नहीं है, अपने डॉक्टर को ट्रस्ट कीजिए। थैंक यू Dhal sir for that amazing message. I think you gave us more hope, and the fact that 85% of us will probably, so let there be hope. And I'm also, sir, at the same time expressing my gratitude to the entire BNI Delhi South family, which has come together from food to medicines to hope to, and people, there are people on this call who lost their near and dear ones, but they are still working tirelessly to keep the morale up. It's a mind over the matter game. So thank you so much, sir. Thank you. I can't, probably I can go on for another hour, saying my gratitude, but we are indeed blessed to have you with us. We are indeed blessed to have all the members with us, because Anjali and Anupam are what all of you are. Thank you so much for being there, folks.
Thank
Stay
you.
blessed,
This
stay
is stay safe. But this is the only time one would say, don't, one has to say it with a smile about being positive. Okay. So keep the good cheer and keep the good work. Stay safe.
Thank you,
guys.
doctor. Thank you so much.
So guys, yes, you can unmute and thank the doc. He'd love to hear thank you and appreciate.
Thank you, doctor. Thank you, doctor, for your
Thank you,
time.
Dr.
Thank
Thank
you. Thank you.
Thank you.
Great.
Thank you, Dr.
Thank you so much, sir.
Really
Take a
nice.
bow.
Dr. Saab, thank you very much. God give you power
Was
to
indeed a
change more
wonderful
lives.
talk. Thank you.
Thank you so much, doctor.
Thanks, officer.